following segment is sponsored by Baptist Health.
Well, you all know that October is Breast Cancer Awareness Month, and it's a wonderful opportunity to help promote the importance of early detection. And who is better than experts from Baptist Health Breast Center? Joining us this morning are Dr. Rachel Pauls, a radiologist, and Julie Turner, who works with high-risk breast cancer patients. Ladies, thank you so much for being here today. Julie, let's just start out with you and just remind people who should be getting mammograms.
Yeah, most women should start getting mammograms at age 40. It's the best tool that we have to find breast cancer early when it's most treatable. So if you're 40 and haven't had one, it's your time. But if you're high risk, you should start at age 30.
And who would be considered high risk?
Yeah, there's a few main risk factors that we talk about. So having a family history of breast cancer in a mom or sister or daughter elevates your risk of having it. Also, having dense breast tissue can increase your risk of having breast cancer. Where to find that is on your mammogram report. So it's always resulted on there of what your density is, if you're curious of what yours is. Also, having a genetic mutation can increase your risk of having breast cancer.
Is the density like a certain number or percentage that they're looking at?
It's actually a category, so you can see it on there.
Okay.
It's under density composition on your mammogram report, so it would show you.
Okay,
Yeah.
and that's more genetic.
It can be, but a lot of younger individuals have dense breast tissue, so it's a normal finding at certain ages, but you just want to know where your baseline is.
Gotcha. Well, Dr. Pauls, you're reading these mammograms every single day. What are you looking for exactly?
Yeah, breast cancer is really multifaceted in the way it's going to show up on your breast imaging studies. And breast imaging is so variable. Mammograms are so variable from person to person just due to that dense asymmetric tissue. There's a whole bunch of benign things that can occur in the breast, prior surgeries, traumas, biopsies to the breast, and just normal hormonal changes with time. So pattern recognition is extremely important to me as a radiologist, but what is more important to me is stability over time. If these things are not changing and are totally stable, but if something is new or changing, then that obviously has a much higher level of suspicion and may need to be worked up.
So that's why we should definitely stay consistent, so you be able to compare those year after year.
Absolutely.
Let's talk about the difference between a screening mammogram and a diagnostic mammogram.
Yeah, so there are two separate types of orders for mammograms. The screening order is intended for just asymptomatic women in the general population who say, hey, I'm 40 or I'm due for my annual. It takes about 10 minutes. Just come into the clinic, easy to do, 2 views of each breast. You'll go home right after. You don't need to meet with a doctor. We'll contact you immediately if you have an abnormality that needs to be worked up. The diagnostic mammograms are a specific order that are going to be ordered by your doctor, and those are for women that are having a specific problem or issue with the breast, or somebody who had an abnormality on their screen that gets called back. And those take more time because we need specific views on the mammogram to evaluate, depending on what it is, to evaluate the finding. And you may need an ultrasound too. So we book more time for those. In addition, those patients are going to get to meet with me or one of the other breast docs when they come in for that. And we're going to go over the findings, we're going to go over the results, and we're going to go over any recommendations.
I'm just curious, what is the difference between like the mammogram picture versus an ultrasound, or why would you need one versus the other?
The ultrasound we typically reserve for certain things, like calcifications in the breast are not seen on ultrasound at all.
Oh.
So mammography is very important for that, but if you have a mass on your mammogram, ultrasound characterizes that much better. So if we see a mass, then we go to ultrasound to really characterize the margins and the involvement.
Let's talk about, Julie, genetic testing. You had mentioned this. How does this play a part in prevention?
Yeah, it helps us identify individuals who have inherited a mutation that can increase their risk of developing a certain type of cancer, specifically breast and ovarian cancer. So it helps us come up with a specialized care plan for their needs based on what they inherited. So it really helps us identify specifically what a patient needs.
What resources are available for those who are high risk or need this genetic testing?
Yeah, at Baptist Health, we offer genetic counseling. We offer specialized care plans, increased imaging, surveillance programs for patients depending on what they inherited.
Dr. Pauls, for maybe some of those women are hesitant or maybe just even scared to come and get a mammogram, what would you say to just ease those fears?
Yeah, I'll tackle kind of the 3 main concerns we get. So inconvenience, it's once a year, it takes 10 minutes. You can self-refer, so you don't even need a doctor's order. If you're due, just call us. We'll book you an appointment. So really not too inconvenient, but it is a once a year just checkup. But what's more important than getting that mammogram? Cost. If you have insurance at all, your screening mammogram is going to be completely covered. If you don't have insurance, then Baptist has grants and funds and foundations that are going to make sure that those people have access to this sort of care. So in addition to cost, discomfort is always a question that comes up. If you are prone to kind of discomfort or pain when we do the compression that we do in a mammogram, take Advil or Tylenol an hour before your appointment. When you come in, ask for those mammo pads, because those are going to help alleviate a lot of that discomfort when you get your exam.
And where can people come and find you or just get more information?
Yeah, we work at the Baptist Breast Center, and I work at the Baptist High Risk Clinic. So we're both here in the same area of Higginbotham Outpatient Center. It's the second floor.
Perfect. Great information, ladies.
Thank you so much for having
being
us.
here. Really
You're very
appreciate
welcome.
it.